Okay, we're recording. Chris. Hi, Chris.
Yes,
How are you?
good. You?
Good, good. Welcome. What campus are you from?
Essington?
All right. And let's see. Jacob. I already know what campus you're from, right?
Yes, ma'am.
Yes, let's see.
Man, they both repeating too.
What, Jacob, what campus? Sorry, I didn't write it down.
St. Lucie, Fortis.
Port St. Lucie. Awesome. Jamaria, we already did you. I don't know who just came in with iPhone. If you could put your name.
Reba.
Pardon me.
Yeah, I'm not sure how to do it.
Can somebody tell us, what's your first name?
Shakia.
Shakia. Can somebody tell Shakia how to change her iPhone name, please?
You would have to log out and attempt to log back in. And when it says under the meeting ID, it'll say something about a Zoom user. And you just delete that and put your name.
Yeah,
Okay.
just click on the three dotted line. Click on the three dotted line. And that is going to tell you rename.
Oh,
So
okay, I see that.
click on the three dots. I'm going to give you the what something is going to just click on the number of that, and it's going to show you rename and just rename it. After that, you can go.
Oh yeah, I see it here. Thank you very much.
I only ask other students to help other students when it comes to tech issues because I'm clueless. I'm old.
Good
I'm
job,
old.
Chris.
I always have to have my kids do everything for me. So anyway. Okay, well, we'll start only because we still have quite a bit more students to come in. So I apologize for any interruptions. We do have 2 sections here. So it's a big class, at least for now. I'm not sure if I'm going to be keeping both sections, or if another instructor is going to come in and take one of the sections. I'm not sure, but for now, I'm happy to have you all. Really happy to have you all. I'm Professor Marvel. I don't know if you've had a chance to read my bio. If you haven't, no biggie. Let's see, a month ago, in May of this year, I just celebrated 40 years in nursing. So I'm kind of in my give back phase of my nursing career. I did some military nursing in the Navy early on. Then I was a director of Women's and Children's Services at a large hospital in Denver, built their whole OB program. Then I just retired last year from school nursing. I was in the schools for over 20 years. So had a wide variety of experience, loved my school nursing. And now I've shifted in the tail end of my career to education, which is where I always wanted to end up. So I thoroughly enjoy what I'm doing. I'm exactly where I need to be. And I consider this giving back to the new nurses coming up, and hopefully share some of my experience and knowledge and strategies of how to move forward. So loved my nursing career, as hopefully you will as well. I just need everybody to turn their cameras on. I have a couple of students that don't have cameras on. And as we know, that's mandatory, right? You guys are in the tail end of your program, right? You have 1 term left, so we all know the rules, right? We all know the rules about cameras, attendance. We'll go through that a little bit. Not being in the car, all that. You've had that through your whole program. So let's see, Dacia, could you turn your camera on, please? Okay. All right, I'll monitor that. So anyway, welcome to everybody. Really excited. I love teaching community public health. I always start out my first week with, tell me the horror stories you've heard about this class, so we can just put those aside. What have you heard about this class? No, go ahead. No, I just, please, I want to hear the feedback so I can get you guys on the right track starting out on week 1. What have you heard?
That it's awful. That it's nothing that it's very difficult to pass. You know,
Yeah, but you don't have a specific,
What? I didn't hear that. Chris?
you don't have a specific textbook, and it's almost everywhere. Everywhere.
Okay. Thank you.
They say you're the best.
I'm the best.
Can't wait to see what you got.
Thank you. Thank you for that feedback. I love reading my evaluations. I just read over the weekend my evaluations from last term, and they were good. So a couple of constructive criticisms for feedback for me. I love feedback. Love feedback. It helps me be a better professor for you guys. What else have you heard?
It's basically everything we've learned, just in a different setting, which I think kind of makes it a little bit trickier to kind of change your mindset a little bit. But overall, that's like the basis of what I learned.
Great. Okay, what else?
Well, it's basically
What?
most of the previous students said the same thing. That is really community is really challenging.
Okay.
Because the materials are all over the place.
Mhm.
Like there is no centered textbook like we can source our information from. So because of that, it makes it really challenging for students.
Sorbia, I'm gonna make it less challenging.
Okay, thank you.
You're welcome. What else? Well, that's not horrible.
No, I was
Huh.
just, I don't have much to say, but I was gonna say like community based is more like going out into the world, going out and reaching out to people in the community, people that's less fortunate, that may need more help in a statistic form,
Mhm.
giving them education and resources and things that they may not know about, to better help them have better access to healthcare and things in that nature, especially if it's like a low poverty type of
Mhm.
area. Those are the ones that's reached out more to, I
Mhm.
believe.
Excellent. Great.
Can I say something, please?
Of course.
It's Lorna.
Hi,
Sorry
Lorna.
I'm late. I had a connection problem and I had to
Okay.
change classrooms. I'm in school right now, but the classroom I was in was noisy a little bit. I had to go to another room.
Okay.
Yeah.
Thanks for the update.
You're welcome.
All right. So that's a good variety of feedback for me. Why do we think that this class is offered in your second to last term?
I think because of the amount of material that it does cover and the different subjects that it does cover is probably the biggest reason. Because I mean, this is my second time taking the class, so I think mainly it covers like a little bit of mental health, but you're also getting a lot of med surg and a lot of maternity and peds. So you
Yep.
gotta kind of understand that before taking this class.
Yep. So this is a class that you need your whole toolbox for. And what I mean by that is you need your toolbox that you've put together your entire program, right? Because in the community, we take care of anybody and everybody. We take care of clients across the entire lifespan, all the way from infants, all the way up to the elderly, right? So we need our fundamentals. It's very med-surg focused. Okay, we need our med-surg, we need our fundamentals, we need our pharmacology, we need our geriatrics, we need our peds, and we need our maternity. Okay, this class, I need you to shift your mindset. Okay, we don't have any clinicals, we don't have any SIMs, we don't have any labs. We are taking your clinical patient from the hospital or your long-term care facility, and we're shifting the care into the home, into the community. Okay? So I need you to shift your mindset. I know most of you are probably taking med-surg and peds. Is that correct?
Yeah.
Okay, most of you. So you're going to need to shift your mindset away from that clinical patient in the hospital that you have. Okay, and you need to shift to think about how we're going to take care of that client in the community. Okay, it really is as simple as that. We use the nursing process in community, just like we do in the hospitals, just like we do in the long-term care facilities. But the nursing process looks different in the community. Right? How do you assess a patient at the bedside versus how do you assess a patient in their home? Okay. How you change a wound, a dressing in the hospital, same, you're going to be changing it the same in the home setting. Make sense? This really is not a hard class. It's a 2-credit class. And as you see in your syllabus, and we'll go through it, the workload supports that. What I tell students early on is just keep up. There's not that much work in this class. Okay, carve out a little bit of time at the beginning of the week, get your assignment done, and be done. Prepare for class and be done. Focus on your peds and your med-surg after you get your community stuff done. Okay, this is actually a really neat class because you're looking through the prism of the community. Think about your community right now, where you live. Who takes care of the hospice patients? Who takes care of the kids in the schools? Who takes care of who watches out for immunizations? Who watches out for work injuries in workplaces? Who does that? I mean, who cares for all those patients that are discharged from a facility and come back into the community and need to be cared for? The community nurse. So this is not, I'm telling you, it is not a hard class. It's just a class you have to look at differently. We're out of the hospital setting. Okay? Whether you work in community or not down the road, you're always going to be interacting with healthcare workers in the community. Let's say you're taking care of a stroke patient and you're getting them ready to go home, discharge, and they need services at home. You're going to be communicating with the community nurse or the home health nurse or the agency that's going to be caring for that client, right? So what I'm asking you is to shift your mind. When you come to class, take off all your hats. Take off your med-surg clinical, your peds clinical, take off wherever you work, your job, where you currently work. Take off that hat and come into this class for an hour and a half and just think about caring for people in the community. And we're not always caring for ill people in the community. We do a lot of teaching, a lot of education. What kind of roles do you think, well, we've talked about a few, but there's a lot of roles that, you know, community nurses rock. Their exposure really elevated during COVID, right? Because remember, COVID was a public health pandemic. I can tell you in the last 2.5 years of my nursing before I retired from the schools, I went from a school nurse to 100% COVID nurse with all the kids in the schools. Okay, so we can be in the community, and we'll go through this in the syllabus. We can be school nurses. We can be occupational nurses. occupational health nurses. We can be home health nurses, hospice nurses, palliative care nurses, faith community nurses. What else will we cover? Immunization nurses, public health nurses. So community nursing is public health is really the big umbrella. Community nursing falls under that. So there's lots of different roles a community nurse may have or choose to have if you go and work in the community. And think about rural, think about urban versus rural. Think if you're a community nurse in a large community versus if you're a community nurse in a very rural area. Looks very, very different. Right? And then also think about the clients. We talk a lot about vulnerable populations. There's a lot of vulnerable populations in our communities. Just look around. Look at your own community. What do you see? Homeless, teen pregnancy, substance abuse, mental health issues. What else? What other vulnerable populations are in your own community? The elderly, right? The kids.
Pregnant
So-
teens.
Pregnant teens. I mean, just look around your own community, think about your own community and think about all the vulnerable populations.
The handicapped.
The handicapped, special needs kids in schools. Right? Lots and lots of vulnerable populations. The community is full of them. Well, we're part of their care. And your discussion post, remember you have your week 1 discussion post is due tonight. Right? Everybody knows about how discussion posts work, right? Initial posts are due on Wednesdays and your peer responses are due on Sundays. So make sure you turn that in tonight. And what is it? Identify a vulnerable population in your community. Okay. So I don't want you to be stressed out about this class. I really don't. If you keep up and get your 1 assignment done per week, if you prepare for class, if you come to class and pay attention and take your quizzes during class, you'll be fine. I promise you, you'll be fine. Please don't stress out about this class. If you fall behind and don't turn in your homework or you don't come to class, yeah, you will struggle. It's an hour and a half a week. And I make an executive decision always at the beginning that I don't really think we need a 10-minute break. And so I knock off that last 10 minutes of the class and we're done in an hour and a half. Is everybody okay with that?
Yeah.
Yeah.
Okay.
Yeah.
So does that help take the temperature down a little bit?
Yes, most definitely. I have to say.
Yeah. Just keep up. Keep up with your, you need a couple hours a week for community. Carve it out. And then go focus on your other classes. You guys are a Wednesday class. So, try and carve out some time Monday and Tuesday. I always say this at the beginning and most students hear it and just keep up. But there's students that don't. So, if you get behind early, we don't have that much. We have 3 exams, right? Weeks 4, 7, 10. Then you've got your 5 quizzes, which we do during class. Okay, and then you've got your HESI. Tina, question.
Are we able to work ahead in this class?
No, not really. I prefer, this is such a heavy term for you that I would prefer that you just stay in the week and not worry about working ahead. Okay. Somebody needs to mute because there's a lot of background noise. If you are a repeat student or a re-entry student and you have not heard from me to set up a meeting, I need you to shoot me an email. Okay, I tried to catch everybody based on the information I had from last term, but I may have not caught everybody. So if you've heard from me, that's great. If you haven't heard from me, send me an email, please. For the students that have heard from me, several of you have responded and we have either set up a quick time to meet to talk about a success plan for this term. If you're repeating, quick meeting, 10, 15 minutes, but I haven't heard from several people that I reached out to. So if you haven't responded to me, I really, really would like to touch base with you. And that actually goes for anybody. Okay, if you are not a repeat student and you have issues or you just want to talk or for a few minutes about going forward in this class, please reach out to me. Happy to meet. I thoroughly enjoy my meetings with students. I love my one-on-ones with students. I love getting to know you guys. And I'm available. And we'll talk about that in a minute. So if you are a repeat or a reentry, please let me know. And then if you also are a student that has accommodations, I need your paperwork. That's not an automatic carryover to the next term. I have to submit that paperwork to Dean Brown and she approves it. Typically, you don't need new paperwork, but it has to be approved every term. Make sense? Okay, I have a couple of people that are not on camera that I need on camera. Otherwise, I have to remove you from the class. Decia, are you around? Oh, there you are. Okay. If you could keep your camera on, I would appreciate it. And I need to see your face as well. I don't want to be looking at ceilings. Okay. So our plan for today, for the next hours, we have to go through that orientation PowerPoint. I realize if you've already had med-surg or peds this week, you've already seen it for the most part, but we do need to go through it. Has anybody not seen it yet?
Yeah.
Everybody has gone through an orientation PowerPoint. Everybody. Well, then we can go a little bit quicker. I just want to make sure, I'm just looking through, I have 2 pages of students. Is there anybody that has not gone through the orientation PowerPoint? Speak up. Great. So we'll go through the PowerPoint and then I want to jump into the module or the syllabus and review a couple of things on the syllabus. And then we'll go into the modules. Okay, that's fine, Decia. I apologize ahead of time for my cough. I'm getting over a pneumonia that is taking forever to clear up. So, okay, before we get going with the PowerPoint, does anybody have any burning questions? No. Great. All right. All right, let's get going. Attendance. Well, we'll talk about it in the PowerPoint. Okay, I'm going to share my screen. Okay. Everybody see my screen? Yes, no?
Yes.
Yes.
Everybody sees my screen. Okay, thank you.
Yes.
Thank you. Okay, I don't know why I can't get all this stuff out of here and make it a big screen. It's only a, hang on, let's see if I can do this. Nope. I'm not tech. Can everybody see? Is this too small for you? Maybe how's that?
Better.
Better? Everybody see that? Okay, you guys know what online learning is at this point, right? The one thing you really need to do is have a good, accurate, secure internet line. Okay, so this class is online. You are expected to be here on Wednesdays at 1 p.m. This is your assigned class time. Okay, so we will see each other for an hour and a half on Wednesdays. The rest is you doing your work and us meeting on the side if you would like to meet. Okay. There are homework assignments, learning activities, quizzes, and exams. Okay, students are responsible to complete the required coursework every week. Just complete it and we won't have any late work issues. Okay, so far what I can gather, we have Port St. Lucie, we have Essington, we have Columbus, we have Richmond. So we have students from all over, which is great. Okay, this is an important slide of who to contact. Okay, I am your instructor, but I'm also the course lead. Okay, so start with me. If you're having issues with this class, please start with me. If I can't help you, we will reach out. I will reach out to Dean Brown. Okay, and Dean Brown is our National Dean of Online Nursing. Okay, and I put her contact information in here as well. So please save that. And there's my contact information is here, and it's also in your shell under the instructor page. Okay, and it also has my cell phone in there. Okay, please feel free to text me, email me, and call me. I'm fine with that. All right, just identify who you are. Okay, I really do pride myself on response times. I'm really good about getting back. I think in a very timely manner. I know if in your syllabus cover sheet, I always schedule the hour before class as office hours. So if you want to meet in the hour before class, please let me know and I'll come on early. Otherwise, we can set up a time to meet anytime.
Professor
Okay.
Marvel.
Yeah.
I don't mean to interrupt you, but I don't see your phone number in there. I don't know
Oh,
if
it's on the
just-
instructor sheet. Let me just
Sorry.
add it. That's okay. Let me just add it in here. You guys can copy it. Can you see me adding it in there?
Yes, ma'am.
Okay,
Yeah.
that's my cell phone. So please feel free to reach out that way as well. If you're having concerns, we don't have labs or sims or clinicals, but anything other than having to do with this class, please reach out to your campus. Okay. So that's my contact information. As far as online instructor, I'm the first contact. I'm available we just talked about that. I always provide feedback on your assignments. I like to do that. I'm experienced in the course content area. Okay. Let me keep going here, kind of go through this more quickly. You guys should already know these communication etiquette. I sent out an etiquette email at the very beginning of the class. So I don't typically have problems with etiquette or student behavior during class. I just don't. I don't. If I do, I'll be in touch with you and we can sit down and talk about it, but I don't have those issues. I don't mind. I don't need people to raise their hands if they want to talk. I'd love for you to jump in. I'd love for the classes to be interactive. I don't want to listen to myself talk. So, you know, if two students are talking at the same time, one stops and we listen to one and then go to the other. So the only time I'll ask you to mute if you're not muted, if there's background noise coming. Okay. We just talked about this. This is a course on Wednesdays at 1 p.m. It goes to 2:40 p.m. Hopefully it'll be done by 2:30 since we're not taking a break. And this is your assigned class. So there's no more, I can't attend Wednesday. Can I attend another section of yours? So I teach 4 sections. I teach Monday, 2 on Wednesday, and 1 on Friday. Okay, and then there's 2 other instructors. They each have a section on Fridays, I believe. So I believe there's 6 sections in this. So if for some reason you're not going to be able to attend class, you got to let me know. And I'll just say this right up front. The most important thing for me that I have to have from you is communication. I can't help you if I don't know what's going on. Okay, if you go and take an exam and you do terrible and then you talk to me after and say, well, I had all this going on, I can't do anything. But I really need, nursing requires effective and timely communication. That's just part of our profession. It's kind of like a ground rule. Okay, so I need for you guys to communicate with me if you're having issues, or if anything's going on that's preventing you from being successful in this class. Please reach out to me. Okay? We all know the late policy work at this point, right? When it's due, it's due. If I haven't heard from you and you're late, it's a 0. Okay, because this is important up here, prior approval. And that goes into the communication piece. So tomorrow morning, when I go in and check my grade book for all your initial posts to be posted for week 1, let's say I have 4 students in this class that there's no post. That's a 0 if I haven't heard from you. If I've heard from you and we work something out, great, no problem. Okay, I'm flexible. That's the other thing. I'm really, really, really flexible. I can work with you, but there are certain things I cannot be flexible on. And this is one of them. If I have not heard from you and you're late, you don't get the 1 to 7 days. Okay. And I'm not real strict. I'm real flexible, but I need you guys to follow the basic policies. Okay. So 8 or more days, it's a 0 for the assignment. Does anybody have any questions on that? I really stay on top of you for homework. So just like I said, it's not a lot of work. Just get it done, and then we won't have to have this discussion. All right, ground rules for attendance. You guys all know this. You're in the second to last term, right? I get a report generated from Zoom after every class. It has sign-in times, sign-out times. So if you come late, it's recorded. If you leave early, it's recorded. Okay, if you step out for a half an hour, it's recorded. All right, and then I have to do my report right after class that goes to your registrars. Okay, so it counts everything. I know you're thinking this is a lot of students to keep track of. Yeah, it is. However, I get this fancy report after every class, so I can see what's going on. All right, you got to sign in with your names, which everybody has, be on camera the whole time. Okay, you can't, and I can't stress this enough, you can't be in the car. Okay, whether you're a driver, a passenger, you're pulled over on the side of the, you can't. If you don't think you can make it home and you're on campus, stay in campus. But I can't have anybody in the car in any capacity.
I do just want to say like a kind of a shout out. I do apologize for that. I was like in the process of on the way home, and that won't happen again though. I
Yeah,
promise.
you can't be in your car. It's just and that's not my rule. That's not my rule. That's a university rule.
No, I understand completely.
Yeah, no worries. If you miss 2 classes, you guys know the 14-day rule, right? If you miss 2 classes in a row, you're going to be dropped. So no need for that to happen. Attendance. Let's see. Attendance is recorded in 15 minutes. And I'm sure you've gone over this in your other classes, but this is, I just want to focus on this. It's taken daily, turn to the register, turned over. Early departures, tardies, class cuts will be recorded in quarter-hour increments. So somebody that comes in at 1:01, believe it or not, you have to get docked for 15 minutes. Okay, and it's an official report. I can't just turn something into the registrar and my report doesn't match what the spreadsheet says. So if you come in a minute late, you're going to be 15 minutes is going to be counted of your absence. If you come in at 1:16, then we got to go to 30 minutes. Okay. And then there's a policy with Dean Brown for when you get to 5%, when you get to 10%, when you get to 15%. This adds up. if you're tardy. Okay, if you miss a class, I can tell you right now, it's like 8.33%. Okay, which already puts you into the 5%. Okay, if you're tardy each week, even if you come in at 101, 102, you're going to get docked 15 minutes every class. It adds up. All right, so at 5%, you're going to get an email through Campus View. If it's 10%, we're going to have to meet. If it's 15%, we're going to have to meet with you, in the campus. Okay, that's not to say emergencies don't happen. Let's say you have had to miss class today, you had an emergency. I still have to dock you for the missing class, the 100 minutes, but if you have documentation, that goes to Dean Brown and she takes care of that. Does that make sense? Even if it's an emergency and you miss class, I have to mark you absent, but you need documentation. Again, my rule of thumb for you guys is if you're going to miss a class or miss an exam or be late or for whatever reason, if it's an emergency with you, your kids, I mean, emergencies happen, stuff happens. Just plan on getting documentation. Okay, it's as simple as that. Because I have to provide that documentation to Dean Brown. Okay. 7 key steps to success. You guys should already be doing this. All right. You all have a copy of this PowerPoint. I sent this out over the weekend. So if you need to go back and review any parts of this, to be successful, keep in contact. That's the communication that I'm talking about. Reliable internet. Maintain, this is an important term. This is a heavy term. Hopefully you have some kind of an organizational time management plan in place. Lot going on. Try your best to identify a quiet place to do your work. Okay, I have no problem with you. I have no problem with students coming to this class from campus. I have no problem at all with you doing it on campus. Campuses are very accommodating. We already know, you already know the day one. I do have some people that haven't, if you're one of the people that haven't accessed the shell yet, I did have a few people that hadn't even been into the shell yet. So if you're one of those people, please get in there and see what's going on. Thanks to everybody that completed the syllabus and technology quizzes. Let's see, let's keep going here. So we have weekly lectures. In your weekly announcements, I provide you, we call them blueprint concept kind of notes. It's a summary of what we're going to be covering. I try and provide you that ahead of time so that you have an idea of what we're going to be covering class. Since we're not doing content this week, we're doing orientation. I sent out a recording. Okay, in your week 1 announcement, there is a recording for the content covered this week. Okay, so that is what you need to watch to get your content for this week. And at the beginning of next week, we'll go through any questions you might have from week 1. Okay, here's our grading structure. 3 exams worth 55, and then you have 5 quizzes that are each worth 1% that total the other 5%. So that's 60 between your unit exams and 5 quizzes. And then you have your HESI, which is worth 20. So if you're not in class on a week that has a quiz, you don't get to take the quiz. Okay, quizzes are considered KGA, so they have to be proctored. All right, so if you're not in class, you don't get to take it. So there's 1% right there. So we do the 3 exams, weeks 4, 7, 10. HESI is week 11. Quizzes are weeks 2, 3, 5, 6, and 8. You have your 4 sets of NCLEX questions, and we'll talk about those in a minute. I think they're weeks 3, 6, 9, and 11. And then your community research project is also called your Vulnerable Populations Project. This is due in week 9. This is where you go, you can look in week 9 to see what the guidelines are, but you basically pick a vulnerable population in your community, kind of like your discussion question this week, but then you end up doing a research paper on this vulnerable population. Okay, it's actually a PowerPoint. And you pick a vulnerable population that you're interested in your community. You have 2 HESI prep, completion of HESI prep assignment. Okay, we'll go through that when we get done with this PowerPoint. You have 2 case studies, okay, but case studies are now renamed CJ Sim. That's where the case studies are coming from. They're coming from NurseThink. Every one of you received an email from NurseThink for you to sign up for an account. Everybody received it. So I would suggest to put on your to-do list this week, if you haven't signed up for the NurseThink account, in your invite email, they provided you a temporary password. You got to go ahead and change that. Okay. So
That's
go ahead.
for, we're signing in, like, what does that help with again? Like the nurse?
CJ Sims are the new case studies.
Okay, so is this for practice or is it like mandatory?
You have to sign up for an account.
Okay,
You won't be able to access your case studies.
okay.
All right.
Mhm.
Tina, can you, where you look like you're in the dark. Can I see you? There you are. Okay. There's a lot of ceilings I'm looking at. If people could just please pull the cameras down to your faces, I would really appreciate it. I really don't want to spend time on this, but there's a lot of ceilings. And there's a few people off camera. If you could please come back on camera, I would appreciate it. Again, we shouldn't be having these discussions. You guys know the rules. Okay, case studies, those are CJ Sims. So if for some reason you haven't got that email, everybody has or should have, let me know.
I didn't get it, so.
Okay, so you are going to have to reach out to your campus. The campuses are coordinating this. So reach out to your campus and let them know that you did not receive the invitation to join, have a NurseTim account or NurseThink account.
Chris,
Yeah,
so you're doing message too. It will be in your message too. Modules.
Oh,
They-
okay, that's easier.
Yeah. So if you go into message too and you click on the modules, you will see CJ Sims there. You click on it, it will take you to the site where you can create your account.
Okay,
Thanks,
And
Sarah.
we're gonna find community case studies there as well.
Mhm.
And okay.
Yeah, and the big NurseThink account. Now, I did my training on it last week. There's some great community things in there. So I need to do some investigation, but I think I'm gonna pull some activities that we can do in class together from the CJ Sim, in addition to your case studies. And then you have your discussion questions. You have 2. They're in weeks 1 and 2. Okay, so it's due tonight and it's due next Wednesday. And then we do, in week 7, have a group project. It's called an infectious disease paper, where I assign you guys groups, which I'll do in the next couple of weeks. Assign you guys groups, and I assign you infectious disease, and you do some research on it. It's done as in a group setting, and it's done in an online format. Okay, where you have to communicate with each other, who's going to do what, who's going to pull it together. So you have one group project that's due in week 7. If you want to look ahead at what that group project entails, then you can go to week 7. Okay, I'll turn on the homework grades in week 6 and leave them on for a couple of weeks. Why do I turn on homework grades? So you can see how your homework is impacting your work. If you're not turning in your homework, okay, it's going to pull your grade down. Because remember, at the end of the term, with your 3 exams and your 5 quizzes, right, you considered your KGAs, you have to be at a 78 for your homework to count. And if you're at, let's say, I don't know, a 78 or 79, and you haven't turned in a couple assignments, and they're all worth, they're worth 5%. Your HESI prep, your vulnerable populations, 5%. If you haven't turned in one of those, you're going to get pulled down below a 78. I had one homework fail last term, and there's just no reason to be a homework fail. None. You guys all know the 78% rule. Quizzes, we talked about. Exams, no changes in exams. What's this? Accommodations. Please let me know about accommodations. Okay, if for some reason there's an emergency with you taking the exam on a Wednesday, you got to let me know. You got to get documentation so that you can get that extension. Okay. You guys know the drill for exams. We'll go through it when we get to week 4, but showing your ID, making sure your desk is clear. Missed exams will be held to the late policy. So if for some reason you have something personal going on, you're taking the exam on Wednesday, you will be given a week to take it, but you'll have a 10% deduction. And of course, if there's an emergency and you have documentation, you'll have up to a week to take it, and there won't be any deduction. And I said this at the beginning, I can't do anything to help you after you've taken the exam. Okay, so you got to contact me with any issues that will prevent you from being successful before an exam. And that's not, oh, I worked 3 nights in a row and I'm really tired. That's not an emergency. All right, homework assignments. You guys should be already planning your time adequately. This is a real challenge. Like I said, 3rd time I'm saying it. This is a challenging term. I understand that. You've got to have your planning, organization, and time management skills. You have to have that in focus. Okay. I already went through late work. NCLEX. You guys already know how to go in and access NCLEX. Please access all of your assignments from the module. Okay, don't try and do an NCLEX with going to www.evolve.com. Don't, because you're not gonna be able to submit me a PDF. Just access it all. In your weeks you have NCLEX. It's already listed for you in your modules what the subjects are. Subject categories that you have to select. And the one thing I'll say about NCLEX, submit me 50 questions at a time. I don't want 2 25s or 5 10s. You're not going to get the full experience of all the subcategories you selected unless you do 50 at a time. One thing I'm going to tell you about NCLEX is I'm a real big believer of learning by rationales as well. Okay, so if you submit me below a 40 for NCLEX and there's time, I'm going to send it right back to you and say, hey, listen, I've reopened it for you. Please redo it. If you would like to redo it for a higher grade. Okay. If you're submitting in the 20s and 30s, you haven't learned a lot from that NCLEX assignment. Okay. You can do NCLEX as many times as you want. You can only submit it once. So if you start with NCLEX and you get a 20, go through all the rationales, go read what you got wrong, why you got it wrong. Why is the answer correct? Why is it incorrect? And then go take it again. Maybe you get a 40. And again, read through the rationales. What did you miss? Why did you miss it? Okay. I wouldn't be submitting NCLEXs that are below 45. Because remember, your NCLEX, they're each worth 1.25%. So if you submit a 20, it's just not going to help you down the road. Plus, you're not going to learn a lot. So I would aim for between submitting 45 and 50. Irregardless of how many times you have to do it. Maybe it took 10 times, but you finally get up to a 50. Does that make sense? So don't blow off the NCLEX questions as, just another task to do. Please, there's a reason we do the NCLEX questions, and there's a reason we pick these subcategories. It's covering the topics we're covering in class. All righty, you guys all know how to grade. And NCLEX, you know how you submit your PDF. It's usually 15 to 17 pages. I go in and check to make sure you've selected the correct categories, and then I'll post your score in the grade book. Hey, any questions on NCLEX? HESI, we'll talk about that down the road. Well, no, actually, we're not. We're going to talk about it right now. So this is your HESI prep. I need to make it crystal clear. This is due in week 9. There is a link to a HESI prep there's a link to a HESI prep assignment in week 9. You've got to ignore that. I tried to get it removed. It didn't get removed. Please use this HESI prep assignment that I sent you in your week 1 announcement. Let's go find it. Okay, this is the one I want you to use. This is the updated version. Let's see. It is in your week 1, content, information, attachments. Okay, it is down here. Updated HESI prep assignment. Please, please make note of that. I mean, it's quite similar. However, I have really toned this one down because if you're using the one from week 9, you're just going to end up filling out a whole bunch of boxes that are not covered on the HESI. What I've done with this is I've gone through the last 2 or 3 terms of HESIs to see what the topics you're being asked about are. Okay, I can't see the questions because this is like your it's a big test bank question. 1,000 questions. They pull from there. I can see the topics they're asking about, but I can't see the questions. So this updated one I sent you in week 1, each box represents a question they're asking. Does that make sense? I really, really need you to let me know if you don't understand this. Please use this one. You can, if you end up forgetting this and you use week 9s, you're just going to be doing a whole lot of extra work. Does that make sense?
Can you repeat that again, please?
Which part?
The HESI prep assignment.
I want you to use the one in week 1 that I sent you. It says updated HESI assignment. Okay? Please use the one in week 1. I do
So
not
what
want
what are we supposed to do with this? Are we going to print it out, then write out?
Print it out.
Fill it,
you don't,
fill it
yeah,
in?
you don't, or you could save it to your desktop because this is something you're going to be filling out all term. I want to go into week 9 and show you the one to ignore. Okay, so I'm going to week 9, right? HESI prep assignment. This is the one I don't want you to use.
Okay.
Got it?
Yeah.
I need you to go back and use the one I sent you in week 1. It's just going to be less work for you and more focused. It's not horrible, it's just a lot of extra work that you don't need to do.
So is it like you want us to print it out, write down the answer?
So here's what I want you to do. Here's this assignment's worth 5%. Here's what I want you to do. You can print it out if you want, or you can save it to your desktop. It's in a Word document. This should be a working document for you the whole term. So by the time you get to week 9, it's just ready to submit. If you don't fill this out all term, then it's going to be a big time-consuming project. Okay, but what I tell students to do, and I try to remind you every week, or every couple of weeks, I try and bring this up. And I say, okay, we have covered disaster. We covered disaster this week. So go ahead and fill this out. We covered health promotion and teaching in week 2, whatever. Go ahead and fill this out. We'll have covered all these boxes over the term. But if you can go in and fill it out as we go, like for example, we're covering, even though you have a recording, Introduction to Community Nursing, Levels of Prevention, Healthy People 2030, Introduction to Vulnerability. There is a whole section in the back about vulnerability. No, maybe it's not in the back. Right here. Vulnerable populations. You can start, next week we'll cover migrant, rural. What I'm saying is we're going to end up covering these topics. So fill this out as you go along. And I always get messages, what do you want us to put in the box? Here's what you need. Think nursing process. For example, let's say you were presented with a patient that had potential anthrax exposure. What would that look like? Think of your nursing process. What might they present with? Right? What are the interventions? Does that make sense? Well, how do you evaluate them? You have somebody present with smallpox. What does it look like? What's the treatment? What's the transmission? Think nursing process. Does that make sense?
No.
So you
What?
write down a little bit of everything about that particular topic.
Yeah, or just think if you were presented with a patient with any of these, what would they present with? What might it look like? As you complete the assignment, please use the nursing process when addressing and completing each topic, right?
Okay.
Each topic is going to require, remember, this is all next gen focused, critical thinking, and then being able to apply it. All right. So what does a patient with anthrax look like? Maybe they present with fever, whatever. Is there any isolation? Are there any medications? Right. Just think of how you would care for a patient with anthrax or Ebola or sarin.
It's kind of like a concept map, like you just.
Yeah, exactly. Exactly. So this isn't this is more of an ongoing study guide. I wouldn't even think of it as an assignment. I would think of it as building your study guide towards the HESI. This is what this is, HESI prep assignment. And then when you go to study for HESI, this is your study guide. Does anybody have any questions on that? This is meant to help you. This is, so on the week we covered disaster.
I have a question.
Yep, go ahead.
I just want to clarify something. Can you please, okay, it's okay. I'll start from Ebola. So, if I'm understanding well, what you're trying to say is that this topic, Ebola, we have to write like pathophysiology, nursing, diagnosis, labs and treatment.
No. Don't make it that complicated.
Okay.
Because remember, we're in the community now.
Mm-hmm.
Okay, we're not in the hospital setting. So let's say we're in an urgent care center.
Mm-hmm.
Let's say somebody comes in with fever, vomiting, whatever. So let's take an Ebola patient.
Mm-hmm.
What might they present with?
Very high temperature at first.
Okay. What do you do to maybe diagnose it? Lab test, chest, whatever, chest x-ray.
Yeah,
right.
blood work.
How do we treat them? You know, if it's a transmission issue, do we put them in isolation? This is each box is meant to be maybe 4 to 5 sentences.
Okay.
Really?
This isn't what? Who said that? Is that a lot?
I said 3 or 4 bucks, 5 sentences. I feel like from what I'm thinking, if you want me to use the outpie, I think I'm going to write it more than 3, 4 sentences.
You can write, you can do that. But what I'm saying is we just need what I would like to see is a summary. What is it? How is it transmitted? How do you diagnose it?
So you want us
How do
to
you
try
treat
to
it?
condense it as much as possible?
Exactly. This is meant to help you with HESI. You do not need to go in and do a complete A to Z assessment of Ebola. I just want I want you to think about, if I get a question on the HESI, which I will, about Ebola, what might they be asking me?
So it's basically the meat and potatoes of it.
Exactly.
Okay.
Okay.
Mhm.
Does that make sense?
Yes.
Yep.
So this is meant to help you. This is your study guide at the end of the term. So my suggestion is to keep up with it. Every couple of weeks, or maybe you stop right before the exam. We do weeks 1, 2, and 3 content. You go back and fill it out. Then we do an exam in week 4, and then we do content in week 5, 6, and 7. Maybe in week 7, you go back out and fill it out. It's just what I really don't want to happen for you is in week 8 to have a blank document. Then you have to go back. Oh, when did we cover that? I know we covered that. What week did we cover that in? Right? And I'm going to stop sharing for a minute because I need to go on another mantra. Okay. Everybody stay on camera, please. Okay, great. Thanks. So I would get as much done ahead of time. You're going to be working on your HESI prep, which is open the whole term. Your vulnerable populations assignment is due in week 11, week 10. Your HESI prep is, let's see, HESI prep is week 9, vulnerable populations is week 10. You have an exam in week 10. So my point is, once we get to week 8 in this class, it's going to get really, really busy. Okay? After week 8, if you haven't started working on some of these assignments, it's going to get real busy. So think about it. I think it's week 9. You have your HESI prep assignment due and an NCLEX. And that's exam review week. Think about week 10. Week 10, you have an exam, your vulnerable populations assignment. Okay. Then you jump right into HESI in week 11. So between weeks 9 and 10, 10% of your homework grade is due. Because your HESI prep is 5, your vulnerable populations is 5. So start on these early. They're open to you. Somebody asked about working ahead. The one things I locked about working ahead were like your NCLEXs. But your group assignment in week 7, your HESI prep, and your vulnerable populations, that's all open now. Okay. So please don't, I had met with a student in like week 10 last week. She goes, oh my gosh, I didn't know we had all this. It's so much work. I said, yeah, we talked about it in week 1. All right. So get working on these projects or start them.
Question, please.
Mhm.
For the group assignments, are you going to put us in groups yourself, or are we going to group?
Yeah, I talked about that earlier. Yep. In the next couple of weeks, I'll be sending out groups. I usually do 4 or 5 people, and you'll have a topic assigned to you. Okay. And then you go into, I told you guys that if you guys want to go into week 7 when it's due, this is all in your syllabus. If you want to go into week 7 right here, I'm in module week 7, infectious disease group project. You can see what it is.
Okay.
Okay. There's what you need to do. Okay. Oh, the other thing is there are no peer evaluations. That didn't come out as well, but we'll talk about that when we get closer. So what are you doing? You're doing an introduction and history of the disease. Who's affected? How is it transmitted? Symptoms, pathology. So this is a more in-depth assessment. Make sense? So you can go in and see what you're going to be doing. I won't be sending out groups for probably at least 2 weeks. I want you to get settled in before we start that. And really, that's somebody taking the lead, sending out a group email to your group saying, hey, how you doing? We're doing rubella. Who wants to do what? Who wants to do what? Do your part, send it back to me, you put it together in a paper, and you all submit the final copy together. No. You all submit the same paper. I realize I'll be getting 5 of the same papers. You don't submit your own section. Somebody puts it together and you submit a final paper, all 5 of you. Okay, we'll talk about that when we get there. Okay. What else? Okay, so we talked about HESI prep. Okay. On your case studies. Okay, your case studies are now CJ Sim. We've already talked about that. Okay. And and it's already built into your module. Okay, so you'll see that, I think it's week 4 and that's the other thing you have, I think, in week 9 is another case study. So like I said, once you hit the 8-week point, it gets super busy. Don't procrastinate.
Our first case studies in week 4, right?
Let's go back and look at my assignments page. Yeah, I don't think you guys have this, but it will tell us real quick. This is my cheat sheet. Case studies, week 4, yeah, and week 9. Okay, so again, week 9, you've got a NCLEX, a case study, and your HESI prep due. Week 10, vulnerable populations. What else? Exam. So again, it just gets real busy. I remember in my meetings with the campuses, once we get down to week 8 or week 9, I remember telling the deans, this is a very busy week, very busy couple of weeks, 9, 10, and 11 for you guys. Okay. All right. I'm kind of adding all this in as we're going through the PowerPoint, so I'm really covering almost everything. Let's see. Always use your rubrics, right? Because that's how I grade. Please be mindful of your rubrics. You should know that by now. I sent you an APA format resource, which is good. Taking exams and quizzes. What haven't we covered about this yet? No, we've already covered that. If you're not in class, you don't get to take the quiz. Specialty HESI exams, we don't need to go through this now. Exam security, reviewing questions. Okay.
Do you give blueprints before each exam?
Yep, we call them, yep. I used to call them study guides. So they're called blueprints now. So your exams are all set up with blueprint topics. Each exam has probably a dozen blueprint topics. We will have covered all those topics, right? So for example, in your blueprint notes this week, I covered 4 topics, right? And I highlighted each topic. I covered introduction to community nursing, levels of prevention, healthy people 2030, introduction to vulnerability. Next week, over the weekend, when I send out your week 2, your blueprint, which are your notes, will include school nurse, growth and development. I take it right from the syllabus. So let's go there real quick. Okay, let's get rid of this. Get rid of this. So let's talk about, let me just jump to the weeks real quick. So here's week 1. Your blueprint notes has 4 sections. Here's your 4 things. Here's your 4 topics, right? Here's all your reading assigned to it. Does everybody know what under reading, when it says see Canvas course, everybody figure out what that is now? Those are in your module, and I'll show you in a second. Okay, discussion question 1. So for week 2, you're going to get a blueprint set of notes. It's going to have these 6 topics in there. School nurse, growth and development, common childhood ailments, family nursing, family health risks. This is your blueprint. And then week 3, we're going to talk about migrant, rural, and homeless. So yes, that is your blueprint. These are the topics that are going to be covered on your exam. Does that answer your question? Yes? No?
I think I was more looking for the one that's actually sent out to say, like how many questions was in each category, that blueprint.
Oh, I'm not sure we can send that out. Have you been sent that out?
Yes.
I'll have to check on that. I know which you're talking about. It comes right from ExamSoft. It's a summary page. Okay. What class have you been sent that for?
I got it in MedSurg 1 and
Okay,
IV therapy.
okay. Let me see if I can send that out. I mean, I can tell you that these are, I mean, I have it printed out. I'm just not sure if I can share it, but I'll double check that. Okay. So you'll get your blueprint notes every week, and then you'll get a study guide. Well, not a study guide, but like a blueprint summary for your exams. Does that make sense? Make sense? I want to show you guys, if it says in the reading section, if it says see Canvas course, it does say that in week 1. It says it in week 2, see Canvas course. See Canvas course. So your first 3 weeks, it says that. Anybody know what I'm talking about here?
Is it above assignments?
Mm-hmm. Yep. Let me get back to this. So for example, this week. Okay, here's your Canvas course readings. Your activities, it's under activities. So here's your 4 Canvas readings that are in the middle section of week 1 in your syllabus. Does that make sense? Tell me if it doesn't make sense. In week 2, it's above your assignments, it's under activities. Okay? You have 2 to read, school nurse and lead exposure. So those readings are, you have readings from your book, you have readings right in your module. What you really should be doing each week, and you guys know this, like for week 1. You know, when you, week 1, oh, you should be doing this every weekend before your class starts. What are we covering in week 1? Here's your weekly concepts. Just go through your module. Okay, here's your reading. See Canvas courses, it's all right here. Just go through the 6 or 7 slides. Here's your readings, Introduction to Community Nursing. Goes through each of them. Levels of healthcare prevention. Healthy People 2030. And Introduction to Vulnerability. So there's your 4 Canvas readings, and you do have some book reading as well. All right, here's your discussion question. I mean, it's good to go through the whole module just to see what's going on for that week. Okay. And then it goes into week 2. Okay. So, questions? Does everything seem manageable?
Yes.
What are you guys thinking?
The way you broke it down, it makes a lot more sense, to be honest
Yeah.
with you. I do appreciate that.
Yeah, so you're going to have some readings. You're going to have your concepts on the left-hand side of the syllabus. You're going to have your readings in the middle. They can come from the book, or they can come from a website. Like in week 1, you're asked to look at the Healthy People 2030 website. And then you may have some Canvas reading, which means the readings are right in your module. And there's some weeks that you won't have any readings in your modules. Okay, so the other thing I want to show you is the overview of community nursing. I mean, look at the things we're going to be covering. You know, when I say it's a big umbrella, we've already gone through all this, by the way. I would encourage you to have a look at the student learning outcomes and the course objectives. You can read that on your own. Here's your books. Okay, and here's your CJ Sim. So and remember, am I sharing?
No, I don't see anything.
Okay. One sec. Let me share. Sorry. I'm back in your syllabus. So what I would suggest you do is on your own course description. Well, let's just read it in case you haven't read it. This course provides a student with an introduction to promoting health and wellness with individuals in diverse community-based settings. Key concepts covered: wellness promotion, independence, interdependence, discharge planning, chronic illness, lots of that in the community, HIV, healthcare environments such as outpatient clinics, homes, diagnostic-based care centers. Right, and here's the last sentence is about your vulnerable populations project. A community project provides an opportunity to examine population groups along the age continuum in the community. The other place that gives you a good overview is my week 1 announcement. Okay, let's go back and look at that. This gives you a nice overview as well. This talks about what we're covering in week 1, but my initial post gives you a, here, welcome to class. Okay, so if you haven't read this yet, if we provide a framework to support your practice in the community-based setting. Now that you've demonstrated success and competence in the knowledge and skills to care for your patients, now it's time to incorporate that knowledge, your skills that you've learned, your nursing process, and how do we apply that to the community? Okay. So we will look at how do we collaborate with healthcare teams. Remember I said at the beginning, you may not be working in the community, but you're going to be collaborating with people in the community. Wellness promotion, healthcare delivery in environments such as the home, outpatient clinics. How do we care for individuals with chronic illnesses, HIV, vulnerable populations? Okay. So look at the different topics we'll cover. We do intro this week. Make sure you look at your Healthy People 2030 website. We're going to talk a lot about primary, secondary, tertiary. Okay, so please do that Canvas reading on primary, secondary, and tertiary. And then we start talking about introduction to vulnerability. Next week, we go through the school nurse's role, growth and development. And that's over, think about it. We could be caring for clients or teaching or discharge planning, clients from infant all the way up to elderly. Common childhood ailments, we go through those. And then we cover special vulnerable populations, the migrant farm workers, the rural populations, specifically homelessness and poverty. And then we go through more special vulnerable populations. In week 4, we cover pregnant adolescents, LGBTQ, mental illness, alcohol, tobacco, and other drug issues. And then in week 5, we start talking about hospice and palliative care. What's the role of the community nurse? Death and dying. We pull in ethics to this conversation, and we talk about how faith and spirituality and the faith community nurse plays a role in the holistic care of the patients. Week 6, we talk about the occupational health nurse. What's environmental health? Think about environmental health in your community. What are the risks? Do you live in a high crime area? Do you live in a crowded area? Do you live near an airport with air pollution? Do you live near water with potentially contaminated water? Those are all environmental risks we'll talk about. What are some barriers to learning? Lots of barriers in the community for learning. Reinforcing health education. And then in week 7, we'll talk about infectious disease prevention and control, outbreaks in the community. HIV, TB, STDs. We'll talk about those. And then the community, the risks for bioterrorism and disaster. We'll cover that. And then week 8, we'll talk about home care, community resources, case management. What's the role of the nurse in case management? How do we manage complex chronic diseases, such as, let's say, COPD, diabetes? We go through several of those. And then week 9, we end up with talking about human abuse and violence, and then cultural influences in nursing. So we cover a lot. There's a lot that has to do with community nursing, a lot. So I hope that those will be interesting topics for you. I hope you can bring your experiences to the class. I can certainly bring mine. And that's kind of an overview of what we're going to be doing. How does that sound? Is everybody like, yes?
It sounds very
Nursing.
interesting, actually.
Yes, community nursing. Yes, yes, yes.
It does sound good.
Yeah, you guys will learn a lot. You'll learn a lot. What questions do you guys have for me?
I do have a question near the end, if that's all.
What?
Just one.
You want to stay on after?
Yeah.
Yeah, okay. All right. Does everybody have kind of a general overview of how this class is going to work? How'd I do? How'd I do giving you that general overview?
I appreciate it because
So-
it's so much easier now. I don't feel like as
Good.
intimidated with coming into this class.
Okay. So has your anxiety level gone from a 10 to a 3 in the last hour and a half?
I want to say 3, but it
me?
went.
For me, I
Oh,
just
Nicole,
want
are
to
you
take
at a
one.
1?
I just
10 to
for me,
9.
No, I'm not at a 1, but it ain't 3.
I just want to take one step at a time because
Yeah.
there's too
Yeah,
much
I'm with
information. So we just want to take one step at a time.
So,
I don't want
Chris?
to. I at the same time, I want to think about week 9, but I want to take week 1, week 2, week.
I get it.
Yeah,
I get it.
because-
However, I'm just giving you a friendly warning that towards the end, it gets really busy. So anything
Yeah.
you can do in the meantime to
Get it
prepare,
done.
that's all I'm saying.
Okay.
So,
Gotcha.
question, so the things that we're reading through each week, I think you said the first test was in week, what was it, 4 or 5? It
4.
will just be on,
Yep.
the readings from week 1 to 3.
Well, tests are from readings, assignments, and lecture. Yeah. So
I do have a. Oh, I'm sorry.
hang on. So your exams are week 4. So weeks 1, 2, and 3 are covered. Exam 2 is in week 7. So weeks 4, 5, and 6 are covered. Exam 3 is in week 10. So weeks 7, 8, and 9 are covered. Make sense?
Okay, thank you.
I have a question for the quizzes for like quiz 2. Will you let us know what is going to be covered on that at a time? Or is it just going to be what basically that outline for exams? Is that how that's working?
It's going to be, the quizzes are on the content we've covered in class.
Okay.
Anybody else? I am happy to stay on and answer any questions. If you need to reach out to me separately and would like to schedule any kind of a meeting or anything, please just shoot me an email.
So are we gonna have reviews before every exams?
Yep. So I'm working on the master schedule now. So the week before, you'll get a blueprint guide. Okay, you'll get a blueprint guide as to the topics that are going to be covered on the exam. And then we will do 3 live review sessions the week before the exam.
Okay.
Okay, so you have the opportunity to attend one or all of those.
Okay.
And you'll get all the recordings as well.
Okay.
Okay, Garcelle, question.
So-
I have a question regarding the
week one, what is it called? The discussion. So I'm currently in the last part where we have to write gaps for the community. So do you want us to put like what we think can help?
Yeah.
Or do we?
Well, what don't they have that they might need?
Okay.
So, and two, the exams, like now I know I want to write my exam on campus. So what do I need? I need to get
Okay.
across to you so that
So
we can
I have no
get the
problem.
proctor. Yeah.
I don't have any problem with anybody taking their exams on campus at all. I do it every term. I need you to, if you've done it before, you know the drill. You need to come
Yes,
up with a
ma'am.
proctor at least 3 to 4 days ahead of time. You need to come up with
72 hours.
I'm sorry, 72
I
hours.
said 7 hours. Yeah.
I need the proctor's name and contact information. And then I reach out to the dean and make sure that the proctor's okay and she's aware of it. And then I will send the proctor and the dean the password and you can take the exam on campus. Yes.
Okay.
I encourage
Thank
that.
you, ma'am.
Yeah, no problem at all. Okay, so in summary, communication with me is really, really important. Keeping up with this class is really, really important. Trying to attend a review session, and I'm going to be sending out hopefully in the next couple of days a master review schedule for all 3 exams and HESI review so that you can plan ahead for the term. Keep up, don't fall behind. This is a different kind of class. Just sit back and enjoy the format. Okay, it's very open. We're out in the community. Okay. Okay, so that's all I have. I'm going to stop the recording. Again, it was really, really nice